Hi, it's Jane with ScrapTasticyarns, and today, with hashtag 50 Gone by 2024, we are going to switch gears a little bit because I'm going to talk about a disorder that many of us women have. There are some men that have this as well, but what is it? It's fibromyalgia. We're going to go over and talk about the overview of fibromyalgia and a couple of recommendations, but this is probably going to be a two-part series. You know, I have not done any topic in lately, so we're just kind of going to do an overview of fibromyalgia, what it is, what it isn't, how it affects some people, doesn't affect others, but the second part will concentrate on ways that you can actually lose weight while you are suffering from fibromyalgia, because there's a study that shows fibromyalgia patients have a 25% lower metabolism, so it's a little harder to lose weight. But anyway, let's get into the medical disclaimer. As always, check with your physician before starting any exercise program or diet, following any recommendations here. Information here is my personal research into different health topics and is not to be considered medical advice. There is a Facebook group called Fibromyalgia and Pain has two N's at the end. There is a young woman by the name of Bree Osborne that she did a video using makeup to show how fibromyalgia affects her. This video is spot on for many of us who suffer from fibromyalgia. So I would recommend that you go out and you try to find that video. It's on Facebook. I will try to link it down below, but I'm not positive if I can or not. But it is a hard-hitting video, and people that watch it that don't know what fibromyalgia is are often a little shocked by the video and the use of the makeup. So I will tell you, if you don't suffer from that, you know, it may be a shock to you. Let me get a drink. I will tell you, for me, most time with my fibromyalgia, I hurt physically every day, all night, all day long. It feels I am bruised at different points of my body at different times. There are times when the pain is so great that it just hurts to move. And generally those days when it's a big fibro flare-up, I'll also have a headache, and I'm extremely exhausted and tired and just want to sleep all day long and as much as I can. And generally that is the best remedy for me. One other symptom that a lot of these articles I'm going to read to you don't cover is, many times for me, my clothes feel like they're full of shards of glass. And let me tell you, I can't wait to get home and get them off. Unfortunately, the public frowns on nudity, so, you know, you have to wait till you get home. But just thought I would throw that in there because that is not addressed in this at all. All right, let's get into it. Fibromyalgia is a chronic, long-lasting disorder that causes pain and tenderness throughout the body, as well as fatigue and trouble sleeping. Oh yeah, lots of trouble. Scientists do not fully understand it. They don't understand what causes it, but people with the disorder have a heightened sensitivity to pain. I have seen studies that say that our neurological nerve endings are not in the same places as most people, and that they are more sensitive. so, you never know. And unfortunately, there is no cure for fibromyalgia. But doctors are doing great strides in learning about it and learning ways to manage it and to treat the symptoms. And a lot of these include not only exercise and psychological behavioral therapy, but also some medications. Who gets fibromyalgia? Anyone. We're all game. But usually more women than men get it, and it can affect you of any age, from children all the way to adult. It can happen in middle age. That is when mine started. And as you get older, you may see that you have it. It crosses all racial and ethnic backgrounds. Money doesn't affect it one way or the other. So, And many times you may have other diseases like rheumatic diseases, mood disorders, or conditions, that may cause pain as well. Some of those are rheumatoid arthritis, systemic lupus, ankylosing spondylitis, arthritis, depression or anxiety, and chronic back pain, plus irritable bowel syndrome. Luckily, I haven't had that yet. I'm going to say that yet, because you never know. Fibromyalgia tends to run in families, so they believe that the genes are more likely to determine whether you would actually develop or not. But there are plenty of people who do not have any history with family that have this disorder as well. What are the main symptoms of fibromyalgia? Chronic widespread pain throughout the body, multiple sites. Pain is often felt in the arms, legs, head, chest, abdomen, back, and buttocks. People often describe it as aching, burning, or throbbing. Fatigue or an overwhelming feeling of being tired. Trouble sleeping. And there are some rheumatologists that think it is a sleep disorder more than just some of these other things. You're also going to experience muscle and joint stiffness, tenderness to touch, numbness or tingling in your arms and legs, problems with concentrating, thinking clearly, and memory, and we often joke that that is fibro fog. Heightened sensitivity to light, noise, odors, and temperature. Digestive issues such as bloating or constipation. Causes. Nobody knows what the cause is. No one. Studies show that people that have this disorder have a heightened sensitivity to pain, so they feel pain when others do not. Brain imaging studies and other research have uncovered evidence of altered signaling in the neural pathways that transmit and receive pain in people with fibromyalgia. They think these changes may also contribute to the fatigue, sleep disorders, and cognitive problems that many people with the disorder experience. It's a joy. Okay. Diagnosis. Diagnosis can often take many years unless you have a really good doctor who's seen a lot of it. There are supposedly 11 pain spots on your body that doctors will check just simply by pressing on them. And if you respond positively to them, to usually 3 or more, they know you definitely have fibromyalgia. When the rheumatologist checked me, he found that out of 11, I responded to 10. And the 10th one was a spot in my lower back. He touched it, and I almost came off the table. And he said, "Yep, you have fibromyalgia." All right, there are no actual tests that you can do. There is no imaging. You can't take an x-ray, a CAT scan, anything to show what it is. So the main symptoms, of course, are pain and fatigue. Generally, when doctors go to diagnose your, whether you have fibromyalgia or not, they will take a medical history. That's true of any doctor. They'll ask you about the locality, severity, and duration of the pain, and whether you have extreme severe fatigue, cognitive problems such as confusion or memory issues. They may also ask you if you have other diseases or conditions. And many times those go hand in hand. It's kind of like thyroid. If you have hypothyroid, diabetes tends to run with that. It's basically the same thing with a lot of people who have fibromyalgia. Many times they have a thyroid disorder as well. So, they do a physical exam. They do check your joints to make sure that you don't have rheumatoid arthritis or systemic lupus erythematosus. Lupus. They will order laboratory and imaging tests to make sure that they can rule out other diseases and conditions. My rheumatologist also did a sleep study. 2 reasons. After I had my discectomy, I had started to snore. Well, sometimes people who snore have sleep apnea. So they wanted to check to make sure that I did not have sleep apnea, as well as, if they could find the reason for the snoring. Me, it just showed I didn't get restorative sleep, and that was a clear clue that I have fibromyalgia. Now, they do a combination of psychological, behavioral therapy, medications, and some self-management approaches, as well as physical exercise and other movement therapies like yoga or Tai Chi. I chose Tai Chi. It helps me the most. It helps me mentally, physically, and spiritually. So I use Tai Chi as my main coping mechanism. My primary physician wanted me to start on a medication, but I chose not to because this medication you have to up it every so often, and then on top of that it causes a brain fog, and I'm like, I'm already in a brain fog half the time. I don't need an additional brain fog. So there are, you have to pick and choose whether you want to take those side effects of some of those medications. But they are finding more and more medications to help, so that's a good positive thing. There are cognitive behavioral therapies. A lot of these may change the way that you think about pain. Lots of times it is helpful, can help with other types of treatment. It is a therapy that can be done one-on-one or in groups. And sometimes just mental health counseling can help with some of those issues. There are some pain medications that some doctors will give. I have told you in the past, my doctor does not like giving pain medications, and I will tell you why. She, when she was in Alexandria, treated one of the Kennedys who has a known issue with drugs, pain medications, sought pain medications. She almost lost her license over it, so she very rarely will give pain medications for that. And I understand that. And I don't really want to take a lot of pain medications anyway, so I try to use other methods, which many times for me can be as simple as a hot shower. But there are some people who cannot tolerate hot showers anymore. I keep hoping that that never happens, because that is one of the fastest remedies for the pain for me, is a hot shower. Antidepressants. Sometimes they will give you antidepressants to help with it, and sometimes, they use anti-seizure medications. One of the anti-seizure medications that they use a lot of now is gabapentin, and it is also used for pain management. But when you start it, you will have to take blood level test before and during while you're taking this. When it first came out, they didn't believe that there was you could get too much of it. Now this is back in the 80s, 90s when it first came out. And they didn't believe you had to do blood work for it. I had a lot of patients who had seizures and were placed on this, and they soon found that they did need to do blood levels, and yes, you can get too much of it. Just pain-relieving medications, analgesic. Lots of times those are anti-inflammatory medications, but they're not always effective because the fibromyalgia doesn't actually cause tissue inflammation, and that's what those medications normally deal with. So, they will try different drugs and things like that to get you some pain relief. You know, best option is just talk with your doctor about it. Now, fibromyalgia treatment is used usually with a team approach, but it's primarily treated by rheumatologists. They specialize in arthritis and diseases of the bones, joints, and muscles. Although fibromyalgia is not a form of arthritis, nor does it damage your bones, joints, or muscles, but they treat it because the symptoms are often similar to those of arthritis, and we're talking about some severe arthritis. Mine is my primary physician. The rheumatologist is signed off at the point because I have not sought any further help with him, because right now it seems to be somewhat manageable. Who knows in the future what will happen. There are exercise physiologists who can help you with the physical activities that you do. Mental health professionals may be involved to help you learn how to cope with your condition, as well as using some of the behavioral techniques and to learn skills and techniques to better control pain. Many times this is a biofeedback system that you're using, and it does work. So there are pain management specialists who oftentimes will help with this. Physical therapists can also help you improve that quality of life with some hands-on care, exercise, and some patient education. My physical therapist, the few times that we did address it and go with it, the whole treatment was massage. So yeah, massage helped a lot. Your primary health care physicians may also help, as well as sleep specialists who also address problems related to sleep disorders, and sleep health. You can live with fibromyalgia. There are some days, like I said, that are just more difficult than others. The main thing that you need to do is to learn how your everyday activities are going to affect you. And if you are having a high pain day, you may choose not to do anything. I always choose to do Tai Chi every day, regardless of the pain level. It does help because it puts me in a mental space where I can deal with the amount of pain normally that I'm dealing with. Exercise is a mainstay for fibromyalgia. Although that pain and fatigue can make it difficult, you do need to keep as physically active as possible. I still go for those daily walks, so that helps a lot as well. Plus, it helps the mood to get out in that fresh air and the oxygen. So, if you're going to start exercising, mostly they will start you at a low intensity, slow, increase it over time. Normally, they'll be walking, biking, swimming, and water exercises. Water exercises are exceptionally well for not only fibromyalgia, but arthritis. There are many I think it almost all Ys, they have twinges in the hinges, and that's really a good exercise for fibro and arthritis sufferers. There are activities that engage your mind and your body as well, and these are yoga and Tai Chi. Like I said, they help. Physical therapists or exercise physiologists can also help you prescribe an exercise program and some ongoing support. That is very important that you have ongoing support. But, as always, make sure you check with your doctor before beginning any exercise program. One of the bigger things that you can do is to educate yourself about fibromyalgia, about the ins and outs as they apply to your life, as they apply to your family life, your partner, the issues that are going to come up and arise with your partner. So, there are a lot of online and in-person support groups. So, having that support network can also help you manage all those difficult times. If you need to, visit a mental health professional if there are emotional problems that arise. You never know. You might need it. Sometimes you need it because of being with a partner, some of those issues that arise with having a partner. One of the biggest things that you can do is to combat your fatigue. And unfortunately, persistent fatigue is a chronic problem with fibromyalgia. So there are a few strategies, and one of the ones that you need to really consider working on is creating a relaxing sleep environment and establishing a sleep routine. That can be difficult when you wake up in pain and you have to feel like you get up and move. You do what you need to do, for whatever works. And here is the main thing that has helped me the most. Go to sleep, get up at the same time every day. Even if I'm having a night where I'm not sleeping well, it helps. Reserve your bed for sleeping. Don't watch TV, don't read, use a laptop or phone in bed, because it'll keep you awake. Those lights that come from those devices keep your brain activity going long after you want to go to sleep, so consider keeping that off limits in your bedroom. Keep your bedroom comfortable, either dark, quiet, or cool. I find coolness helps me sleep better, and that is just something that is normal for most people. They do a deeper sleep if they keep the room a little bit cooler than the rest of the house. Avoid stimulants like caffeine, alcohol, and nicotine. Wind down before bed. Avoid working or exercising close to bed. Try some relaxing activities to get you ready for sleep. Listening to soft music, meditating, or taking a warm bath. The most important thing, pace yourself throughout the day. You may not be able to get all the things done that you once did, and not in the same amount of time. Don't use up all your energy each day, because it's going to make your symptoms worse. Trust me. I know very well. I will tell you, there is a lot of hope. There are a lot of doctors and institutes of health that are trying to work to understand the causes of fibromyalgia and to develop new treatment strategies. And some of those are studying the neural pathways that underlie pain in the fibromyalgia area. They are working to identify more effective pain management approaches. Oftentimes they'll use brain imaging to help study those neural pathways. So if you're in an area or someone has asked you to consider participating in that, you have fibromyalgia, consider doing it. I have done it in the past, and I will probably do it in the future if asked. It's just very good help. Researchers are also working to develop imaging and laboratory tests can help with distinguishing fibromyalgia from other conditions that cause pain. They are hoping that eventually they will be able to provide a diagnostic tool that will help it so that they can avoid treating that fibromyalgia with opioids. So, because, that's addictive and really doesn't really help the disorder whatsoever. So they are also doing some things with transcranial electrical stimulation, which is a small medical device that delivers electric currents to your brain. This approach they believe it works by altering your pain processing networks in your brain. And it's already shown a lot of promise in treating depression and chronic pain. Some of the other things are light, music therapy, exercise, heat therapy, and nutritional supplements to help you with that. So yeah, that is basically it in a nutshell. There are some other ways that you can help to manage with this. First of all, pain is a given if you have fibromyalgia, and so are fatigue and brain fog. They can be challenging, but you don't have to put your life on hold because of it. It just means that you're going to have to make adjustments in your life, anywhere from working to your parenting responsibility, household chores, and even having fun. Try to take a more active role in managing your condition. As always, one of the things they say is stay on your meds. That helps. Here is another great suggestion. I am a big fan of journaling just because it helps mentally, helps with the stress and whatever you're going through, depression, you name it. It can help with all kinds of things. They tell you that if you will keep a journal and bring it with you to your doctor visits, sometimes it can help you zone in on what is bothering you and see what helps. Make sure that your doctor has experience with fibromyalgia. Not all doctors do, so you want to make sure that they do have that. There are some complementary therapies such as acupuncture. I haven't tried that one yet, and massage for pain relief. Massage does help, so consider that. Also, be as active as you can possibly be. That's a big help as well. They tell you basically aim for 20 to 30 minutes, 2 to 3 times a week. If you have to do it in 5-10 minute chunks, do it. Whatever, it will help. Now, this last one I found was rather interesting. Exergaming. It's video games that include exercise. So maybe that Wii that you haven't used in a long time should be dusted off. Or maybe the dance studio, video game, whatever. So, those things can help with your body as well as track those kind of things. And you can combine it with virtual reality. And hopefully it'll help you mentally as well. As always, you want to practice the good sleep habits. Those will help. Make sure that when you plan your day, you are considering whether you have a high fatigue day or high pain day, and to plan accordingly. And if you can't, don't be afraid to tell people, I can't do it today, sorry. Don't be afraid. You want to make sure household chores, those kind of things, you want to break those down into manageable bites. Maybe you sweep the floor and then, 6 hours later you mop it. Build in those rest periods. Stress relief. This is one of the biggest things. Stress affects us in so many ways, just around, period. So, consider saying it's okay to say no if you need to. Don't be afraid to tell people no. I can't do that today. No, I'm sorry. I won't do that. Whatever you need to do. Now, there is guided imagery. There is also guided imagery that can help you with replacing those negative or stressful feelings with some pleasant images. YouTube has a ton of guided imagery, guided meditation. These can help bring a lot of positive thoughts, focusing on your thoughts, those kind of things. And surprisingly enough, they can help with the pain. You know, consider Tai Chi, yoga. Those are great things to help with movement. It's also exercise, so that may be a great way to handle it. Focus on nutrient-rich foods that'll give you more energy to help you avoid your other problems. Now, this one thing I found rather interesting. There is one study that showed light and moderate alcohol drinkers have a better quality of life and less severe symptoms. In this study, moderate meant 3 to 7 drinks in a week, not all in one day. Also, have your doctors check your vitamin D levels. A lot of people who have fibromyalgia usually have low levels of vitamin D, so check that out. The other thing, of course, is to avoid caffeine as much as possible. If you drink 4 or more cups of coffee or a caffeinated drink, that actually leads to more fibro pain. So, relationships. This is a difficult one. It is. Some partners do not understand. Some partners are not willing to understand. They think that you're making an excuse. It's very important that you sit down with your partner on a regular basis to talk about what's going on with you. Listen to each other, problem solve together. If that's too difficult, then consider counseling. Thomas was a great partner. I mean, he went all out. He got me a body massager that I can use, and does help many times. When he was away, it helped. He did massages. He did lavender sleep pillow. I will tell you, there is another thing. Dr. Teal has this lovely little spray that can help you with sleep. One is lavender and chamomile. The one that I use is lavender, chamomile, and sandalwood. And you can spray it around the room or spray it on your pillow, and it does help with the sleep, so you get a deeper sleep. So consider doing that. Yeah, that is basically it for this first session. And so I will see you again tomorrow, and we'll talk about some ways diet affects it and some ways that you can work with your diet to help your fibromyalgia. Alright guys, see you again soon. Remember, choose kindness, be kind to one another, love one another, get out there and see this big beautiful world we live in. See you again tomorrow. Bye.